progressive, respectful, mentoring, compassionate. These are the values of Palmdale Regional Medical Center. And now we proudly present Palmdale Regional Radio. Here's Melanie Cole.
Palmdale Regional Medical Center Bariatric Program has recently earned an accreditation with Aetna as an Institute of Quality, and my guest today is Dr. John Yadgar. He's the Chief of Surgery and Medical Director of the Metabolic and Bariatric Surgery Center at Palmdale Regional Medical Center. Dr. Yadgar, tell us about this accreditation with Aetna. What is this? And tell us about some of the others that you've received.
Sure. Good morning, Melanie. Thank you for the opportunity. Absolutely. We really are privileged to receive yet another recognition by the medical bodies and the insurance bodies. As you know, bariatrics over the last 15 years or so has gone through a huge evolution in terms of the bodies that supervise, including the medical and surgical bodies that supervise these programs, to ensure that we are always evaluating our outcomes and making sure that we deliver a service that allows for excellent results. And so as part of this and as an extension of these, various insurance companies mandate subsequently evaluation of these programs to ensure that the quality that is delivered is second to none, with appropriate choices for the surgery and with patient selection and delivering the optimal surgical procedure, and of course their follow-up and subsequent improvements in health and outcomes. So this award that we received with Aetna is our fifth that we have now received in the line of recognitions, and we're very proud of that. It's absolutely significant in reflecting the teamwork that goes into these programs, because it's really a multidisciplinary, and it includes the engagement of the hospital, of the staff, the nursing, the coordination with the nurse coordinator, with the surgical team and surgical staff, the nutritionist, the pharmacy, the surgeon, of course, and the entire team of people that are engaged in managing a patient from the moment the patient seeks consultation for bariatric surgery, through their preparation leading up to the surgery, and then their follow-ups afterwards, and assessing the quality of life afterwards. So the awards that the program has so far obtained include the American Society of Metabolic and Bariatric Surgery in conjunction with the American College of Surgeons. The program is also awarded a Blue Cross and a Blue Shield Center of Distinction, and the same with Cigna and, of course, now Aetna. And it has also been awarded multiple awards through Health Grades, which is one of the bodies that assesses the standards of medical care, and also we've been awarded by Kaiser as one of their center of distinction. So this really speaks volumes about the care that goes as a holistic program in caring for these patient populations, and we are delighted to offer this, and we continue to, hopefully improve every step of the way. And this is not the end for us. We really strive to always seek perfection, and this is yet another milestone, so we are delighted and grateful for that.
It is wonderful, Doctor. Now tell us, with all of those accreditations and distinctions, what do you want a patient to be looking for when they are looking at a bariatric surgery facility?
So I think it's really important to understand that a program really has to encompass the patient's journey through this whole process. And when they do look at the integrity of a program, the person really needs to understand, okay, is this just a place that I walk in through the doors, get surgery, and leave, and I'm done? Or is this a place that I can actually go to, be given the time to discuss my challenges and make sure that I get a good assessment and a risk stratification and suitability of surgery, and have an opportunity to discuss my options and whether they are surgical, non-surgical, and if they are surgical, what would be the best choice for me, and to recognize that the program has a history, and to really search out what are the outcomes the program has had, what capabilities the surgical team has, how many operations have they done, what is their success rate, what is their follow-up like, do they offer support group, are they going to be available for me if I have a question, can I reach out to my doctors when I need them? And so these are all very simple questions, but if you don't really think it through, you may take it for granted or just assume it, and that would be not a good thing. You really want to be objective, have your list to go through. Okay, there's coverage 24/7. I can talk to my doctor when I want to. I can talk to my nurse coordinator when I want to. I can go to the hospital if I have a question. And these are things that I think distinguishes our program from a lot of others, because we have a policy where the patients have 24/7 access. Everybody's a trained staff. They have the cell phone directly to the surgeon. They have the direct access to the nurse coordinator. They have direct access to the office staff. And that way, a patient knows that if they are going through this journey, that they have a full support leading to surgery and beyond. And, this is a lifelong commitment on behalf of a patient who seeks to get weight loss. And they have to understand it's not just a matter of getting an operation. It really involves them making the right moves leading up and beyond, eating correctly, keeping their activity, making sure they continue to take their supplements, make sure they follow up with their doctors to ensure that their success is ongoing. And we have now a lot of data on 15 and 20-year follow-ups that suggest that a good portion of patients maintain a significant amount of weight off years away from surgery. And that comes through engagement that is ongoing between the patient, their surgeon, their physicians, and their entire group that have continued to care for them.
That was a great explanation, Dr. Yedgar. Now, as we're discussing bariatrics, and if somebody knows that this is a tool to help them change their lives, what can they expect as far as life after surgery like this, as far as lifestyle management? You mentioned if they're adhering to these things, the supplements and the exercise programs that you mentioned, what is it like for them to go out to restaurants or to cook at home, to learn to cook if there's somebody who never really knew how to do that? Tell us a little bit about life after.
So, with the advance and progress made in bariatrics, the industry, certainly in the food industry, has risen to the challenge. And I'm delighted to see that the opportunities that are out there now are a lot better, and a vast choice and array of things that patients can indulge in that are healthy eating options. Certainly, I will tell you, from a global standpoint, that after weight loss surgery, the patient's lifestyle, in majority, if not entirely all, but in majority, and we're talking about 99 percentile, improves in multifacets. And this is in terms of their overall health, which is some have sleep apnea, which is a condition where the patients, when they fall asleep, they can stop breathing for a short period of time, and that can long-term affect their cardiovascular system. They get rid of that. Vast majority get rid of diabetes. Vast majority get rid of their cholesterol or their blood pressure or their joint problems. And by getting rid of these, they reduce their risks, they improve their longevity, they reduce the risk of developing certain cancers, such as uterine, breast, ovarian or prostate or colon cancer. And so the quality improves, risk of diseases and development of diseases, such as heart disease and strokes, drops, the longevity improves. So there's absolutely improvement in medical side. Also, there's quality improvement in daily things, the ability to have more energy, the ability to be able to do more, run after your kids, simple things, being able to tie your shoelace, simple things like getting on an aircraft and not having to ask for a seatbelt extension. These are things that none of us really think about often it's taken for granted, but it really is a burden on a lot of patients that have struggles with obesity. So these aspects of their quality of life improves. They are much more confident, self-assured. Aesthetically, they feel often pleased about the results of their weight loss. And then their social life changes. You know, a lot of patients who've had obesity over the years tend to avoid social interactions. And after they lose their weight, they're a lot happier to go out with friends and go out and, you know, enjoy their social time, whether it is around the table, having meals with their friends, or other aspects. And as I started to say, the options for these patients now is so much more vast, because you go down a supermarket aisle, we have now so many options with regards to gluten-free options, with low-sodium options, with low-calorific foods and high-protein options. And in terms of supplemental nutrition, there's a vast array of protein products that are out there in liquid form, in powder form. And part of this program is emphasized on education. So we really take our time, beginning even before surgery and after, through support groups and other forums, to let patients know, you know, these are the kind of products that you want to seek out through the websites, through the supermarkets, through the various restaurants. As you probably see yourselves, in a lot of restaurants now, the items have calorific value associated with the food put right next to the food. So patients can be very selective objectively. And it takes a little bit of time, but as long as they change their frame of mind, they tune into it, they certainly can enjoy their lives as they did before, continue to have celebrations, Thanksgiving, Christmas, and all the holidays with their families. They prepare more selectively, they prepare more optimally, they eat healthier, and we often see that when one member of the family does this, others jump on, and the whole family starts to eat better and healthier. And, you know, eating is a social aspect of our lives and is a family time when people sit around the table. So it's the best time to allow exchanges, interactions, and to educate the other members of the family how to eat better, how to be healthier. And we see that, we emphasize that in this program. And I would tell you, majority, as I said, 99% of our patients will tell you their quality of life has vastly improved, and they eat better, they're healthier, and, you know, they get rid of a lot of their meds, and they actually end up cost saving through this process, which is a delight, and they can spend that money on their vacations and other things. So it's really a life-changing experience, and that's what makes this whole thing so exciting for anybody who's in this profession, because we see these transformations as really a metamorphosis from that cocoon to the butterfly that flies and spreads its beautiful wings. And it's a delight to see a patient do that, and it gives us all the positive energy we need to continue and offer these services to these patients, and we are very grateful for it.
And I can certainly hear your passion, Dr. Yadgar, for what you do in helping so many people. As we wrap up, tell the listeners what that you would like them to know about this accreditation and the wonderful services that you offer at Palmdale Regional Medical Center, what they should be looking for and what they should think about when they're considering bariatric surgery.
So I would say that you don't want to rush into any decision, that a patient should really evaluate their options, make sure that they have given all the alternatives the merit that it deserves with regards to starting to eat healthy and keeping a lifestyle that is active. And then if they feel that they've done all that, which majority of times patients, by the time they consider a surgical option, they already have been through that process, then to inquire about the details of the program, and they can approach the hospital certainly through the bariatric program office, and then they can approach us through our direct office, and we will send them information, and we will meet with them. And they want to feel comfortable and get reassured about the fact that they would be treated with utmost support and respect during the whole journey, because often patients have had negative experiences with some of their health providers through the years. So it's important that they feel this is a setting that is entirely focused on them as front and center, and that the program has had a 15-year established reputation, and hence resulting in these certifications, and that they will, God willing, go through this and be going through the transformation in a safe environment with good outcomes and ongoing support, and that they are always welcome to reach out and ask questions, and if they need anything, to let us know. And we are here for them. And so the message is, if you feel this is the right decision for you and you want more information, we are just a phone call away, and we'll be delighted to help them in any form we can. If you are thinking of having bariatric surgery and would like more information, please feel free to call the following number, area code 661-723-7833. And we look forward to going on the journey to better health with you. I wish you all the best. Thank you.
Thank you so much, Dr. Yedgar. You are one of our favorite guests, as always. This was a fantastic segment, and thank you for sharing your expertise and giving such great advice to people that are considering bariatric surgery. And that wraps up another episode of Palmdale Regional Radio with Palmdale Regional Medical Center. Head on over to our website at palmdaleregional.com for more information and to get connected with one of our providers. If you found this podcast informative, as I did, please share on your social media and be sure to check out all the other fascinating podcasts in our library. Physicians or independent practitioners who are not employees or agents of Palmdale Regional Medical Center. The hospital shall not be liable for actions or treatments provided by physicians. I'm Melanie Cole.